Good morning. And for the next 12 minutes, I'll be talking to you on the AOSR MR Safety Survey as part of this MR Safety course in the Asian Society of Magnetic Resonance in Medicine annual event. Before starting, let me wish to thank the President of the ASMRM and also the Chair of the QSS Committee, the Quality, Safety and Standards Committee of Asian Oceanian Society of Radiology, Dr. Wing P. Chan, for giving me this opportunity to be part of this course. Ever since this committee was formed, Dr. Wing P. Chan and the President of AOSR, Dr. Evelyn Ho, and the Chair of the Asia Safe, Professor Ang Kwan Hoon, with whom we had our first meeting of the QSS committee, assigned MR safety, to promote MR safety in the Asia-Oceanian region, and assigned me to take charge of this responsibility. So as part of these initiatives, we had designed an AOSR survey based on to understand the baseline practices in the Asia-Oceanian region. This was not a research survey. The survey was intended to collect baseline data from the Asia-Oceanian region. The Asia-Oceanian countries are diverse socioeconomically, culturally, and geographically. So an understanding of the local situation in each country is needed to promote and implement optimal MR safety practices. So we designed an online AOSR QSS, that's the Quality, Safety and Standards Committee survey, focused on the status pertaining to MR safety regulations and practices in member countries of the AOSR. The methods that we followed were the survey and response patterns were developed by members of the QSS committee of the AOSR. The final questionnaire was developed in English and was converted to a Google form document that enabled online administration. The survey included questions on the availability of national legislation or society guidelines on MR safety, including zoning, screening, and incident reporting systems. The national organizations in AOSR were requested to disseminate the survey questionnaire to the members. The online survey was open from 1st of October 2021 to the 1st of November 2021. As part of the promotion campaign of the AOSR survey, we did several country-specific campaigns on MR safety awareness. Two of them were India campaign. And the topics that we discussed was present training standards of radiologists and technologists in government and private hospitals and how to improve, training for non-radiology staff in the hospital, MRI safety in departments outside radiology departments where portable or per-operative MRI is installed, incident reporting and what is required to be done. And this was the first session that was inaugurated by President of AOSR, Dr. Evelyn Ho. The second session that we conducted was inaugurated by the chair of the QSS committee and the president of the Asian Society of Magnetic Resonance in Medicine, Dr. Wing P. Chan. And the topics that we discussed were need for MR safety board in the country, role of MR safety board and adherence to MR safety standards by regular checks and auditing in the department, and the need for the radiology associations to be involved in the formation of the MR safety board. The survey elicited 59 responses from 18 countries and included responses from the national radiology societies and individual respondents from some countries. None of the respondent countries reported the presence of national legislation on MRI and MR safety. And most countries, 90%, did not have documented National Radiology Society guidelines on MR safety. These were the countries that responded to the survey: India, Taiwan, Thailand, Singapore, Malaysia, Philippines, Republic of Korea, Bangladesh, Vietnam, Sri Lanka, Republic of China, Qatar, Pakistan, Oman, Japan, Indonesia, Fiji, and Australia. 79% of the respondents reported that the MR safety guidelines were available at the institutional or the hospital level. 93% respondents reported the availability of MR safety guidelines at the radiology department level. Most radiology departments use a checklist or protocol for pre-MRI assessments. 84% of the respondents reported that there was site restriction or zoning for their MR services. 72% respondents reported the availability of a list of MR safe items at the departmental level and the provision of this list to patients before MR imaging. 86% respondents reported that there was regular screening of MR staff. However, screening of non-MRI personnel was reported by only 57% of the respondents. 85% of the respondents units where screening of non-MRI personnel was done reported using ferromagnetic detectors for screening. Only 71% of the respondents reported that they screened the persons accompanying the patient for MRI, and 75% of these respondents reported using ferromagnetic detectors for the screening. Regarding MR safety training for staff at the respondent radiology departments, there was absolutely no training in 20% of the departments. All new staff underwent training in 36%, once in a year in 31%. And what about the MR safety training for medical staff outside of radiology department? This is very interesting data. 55% do not have any kind of MR safety training or MR safety orientation programs for non-radiology staff, for medical staff outside of radiology department. MR safety incident reporting system. What is the status in Asia-Oceanian region? 43% do not have any kind of MR safety incident reporting system in the member countries and the respondents of the survey. The reporting of critical incidents is important from the perspective of magnitude and provides a great learning opportunity to further improve or refine safety standards and processes. So these were the findings of the survey that we conducted, and the manuscript, and with the manuscript was circulated and it was published in the AOSR newsletter too. Some of the major recommendations in the survey was to have more of a awareness campaigns and training and certification programs. We conducted 3 webinars on different aspects of MR safety. The first of which was conducted on December 5th on the topic of what lessons have we learned from MR accidents. The keynote addresses were given by speakers Dr. Mathew from Philippines and Dr. Anirudh Kohli, who is editor-in-chief of Indian Journal of Radiology and Imaging. In January, we conducted another webinar on MR safety. The topic was implementing pragmatic MR safety in a healthcare facility. The keynote addresses were given by Dr. James Hallinan from the National University Hospital in Singapore and Dr. Elaine Khan, the Hong Kong Children's Hospital in Hong Kong. Both of them were later honored by the AOSR as the MR safety ambassadors for the region. And the third webinar was a very different one, which we thought we will get the industry perspectives on MR safety. The industry players and their role in MR safety was discussed with the representations from the major industry players from GE, Siemens, and Philips. And the topics that we discussed is how is the industry collaborating with the end users? What aspirations and what we can expect in the future from each vendor, and what can or are they doing to assist users to help minimize MR accidents. So these sessions had a reasonable good participation from the member countries of AOSR region, and it was well appreciated too. Before concluding my session, I just want to propose a concept integrating the suggestions that and inferences that we had from the survey on a model of on MR safety, and with which will help us to have an action plan in the AOSR in the Asia-Oceanian region, is the MR safety pyramid. MR safety pyramid, to reach at the top of the MR safety, we need to have 4 steps: training and responsibility, training and assignment of responsibility, communications, the systems and the protocols of the SOPs. These are the 4 steps towards MR safety. And the base and the sides of this triangle has to be very strong with the mission, the team, and the leadership. The priorities in working to build the MR safety pyramid in your institution is some of the major lacunae that we have come across in the Asia-Oceanian region is identification and demarcation of specific risk zones, especially in the MR installations in the secondary levels of healthcare. The zone 3 is missing, and this is one area that we need to give more importance. Design of specific educational programs dedicated to every category of professionals that work in or might visit MR sites at regular intervals. There is a need for development of state-clear MR safety procedures, including screening forms and protocols. There is a need for rigorous but easily manageable incident reporting systems with focus on prevention and learning from mistakes, and to promote just culture within the department and the institution. A brief description about the MR safety pyramid is about the mission: to promote MR safety practices and to reduce MR accidents, to increase MR safety consciousness and promote just culture for patient safety. The team comprises of the MR medical directors, MR safety officers, and level 1 and level 2 MR personals. The leadership is a much more bigger canvas, where the MR safety committee at the institutional level, MR safety council or boards at the national and state levels, with the radiology associations and the health authorities being the representatives in that. Communication is the essential key to build the MR safety pyramid within the department, within the hospital, with the patients, with the industry, and with the health authorities. Communication is the key. The systems, the third step towards MR safety, is focused basically on the MR safe in environment. And the fourth step towards MR safety is the importance of protocols, SOPs, and audits on normal and routine situations, as well as for the special situations that we encounter during the MR practice, on implants, devices, and objects, on use of MR contrast agents, use of MRI patient risk assessment, the protocols to be used for physiologic monitoring during MR studies, and for pediatric patients, for claustrophobia, anxiety, and sedation, special consideration for radiofrequency thermal issues to avoid burns, and the protocols for unconscious, unresponsive, altered level consciousness patients, for patients with pregnancy or with healthcare practitioners with pregnancy, what are the SOPs to be followed. So these are the areas that we need to focus. So I have briefly explained the AOSR MR Safety Survey results, as well as the action plan that we had after going through the survey results. So this is open for discussion, and I wish to thank once again Dr. Wing P. Chan, the chair of the QSS committee, and the president of AOSR, Dr. Evelyn Ho, for initiating this MR safety, for giving priority for MR safety in the Asia-Oceanian region. And thank you all the delegates, for the patient hearing. Thank you all.